Over 80 million people will suffer from low back pain this year and is the leading cause of disability from work. Today, this video is going to go over the 4 types of treatment that exist for low back pain, how you can identify which type of treatment your low back pain will respond to best, and how to do it yourself at home safely and effectively. Stay tuned. The first treatment classification is spinal manipulation. The easiest way to identify if you fit into this classification is if you're between the ages of 18 to 55 plus. You have a recent onset of low back pain, so within the last 16 days, whether that was an event at a sporting event or a car accident or an exercise program, or you just woke up one day and you've got back pain, whereas the day before that you didn't have any. And you have no fear of having your back cracked or popped. The biggest caveat to this is that if you have any pain that goes down your legs, it can't go past the knee. If you have any pain that travels past the knee, then you don't qualify for getting spinal manipulation. You need something different. If it's above the knee, then you qualify. One quick test to see if you have any pain past your knee is if you bend forward. So Colton here is going to bend forward, knees stay straight, reach down as far as you can go. If doing that increases pain or brings pain past the knee, then spinal manipulation is not the best course of treatment for you. If you do have pain past the knee and you go forward with a treatment that includes spinal manipulation, back cracking, you do run a risk of increasing your pain and having a difficult time getting rid of that pain past your knee. So sciatica, radiculopathy, radiating pain, these are all terms to describe some compression of the disc onto the nerve that travels down behind the leg, and that manipulating that spine could cause more damage to that disc and more irritation to the nerve, which can prolong your recovery, even make things worse, leading to injections or surgery. So we call that peripheralization. So if you move or bend in a way that then makes the pain radiate down further, that's called peripheralization, or pushing the pain to the periphery of your limbs, versus centralization. And the way that we test that is if Colton hands on his hips, knees stay straight, and just begins to lean back slowly. Even if it's pain-free, nice and slow, doing that repeatedly, then he gets less pain in his leg, even above his knee. That's called centralization. So how does he respond? Does he get relief with extension or relief with flexion? Because if he does, then we identify which combination of exercises are going to be beneficial for him. If you identify that you would be a good candidate for spinal manipulation, the best thing to do is to head to a chiropractor or physical therapist who is qualified to do spinal manipulation. The number one cause of any kind of injury due to spinal manipulation is done when people try to self-manipulate. So they try and do it all by themselves. Those are the folks that end up with the most problem, the most damage to their tissues when they try and do it themselves. So we're not going to demonstrate or support that. A lot of folks do, and I know it happens all the time. When you read the literature and show all the folks who have adverse events to spinal manipulation, it most commonly is on folks who are trying to do it themselves, particularly with the neck, but also with the back. So easy enough. There's chiropractors and physical therapists all over the place. Go see one who is qualified to do that if you fall into that category and are not afraid of having your back cracked or popped. The second classification is a stability program, and how you'll know if you'll benefit from this treatment protocol is if you have a positive sign with any of these tests. The first of the two is, can you bring your leg knee straight past 90? So 90 degrees is right there where he's perpendicular to the floor. If he can go past 90, he's too flexible. And that means you would benefit from a stabilization program. Again, these are typically female. They typically are in their late 20s, 30s, 40s, who have a history of being cheerleading, dancing, gymnastics, just hyperbendy, very flexible, always have been, and then now they find themselves in this situation with episodic low back pain that usually have some kind of event or injury that happens. They're laid up in bed for 3 to 4 days, and then they're sore and achy for the next 4 to 5 weeks before it kind of goes away on its own, it appears, but then these episodes of low back pain keep reoccurring and sometimes even happen more frequently. These are folks who would benefit from a stabilization program. The other test that we do, roll over onto your stomach. This is one that you would need a super friend. We're going to find the low back. You feel the little bumps in the spine. I put my index finger and middle finger on either side of that bump in the spine, and then I bring my hand over and just put pressure straight down. Any pain there, Colton? On either side, all the way down. And if he says, okay, that one right there hurts, okay, that one hurts, lift your legs up. Stay there. I pushed back down. Any pain there?
No.
If the answer is no, after he activates his legs into extension, that means you would benefit from a stabilization program. This indicates that we have instability at rest and the muscles around it need to contract in order to stabilize it. And so we need to help facilitate that. And so our favorite exercises for this are the McGill 3, so go ahead and lay onto your back. The first one we like to do is called the curl up, so put your hands underneath the hips, one leg is up, and he's going to basically do a crunch and a curl, flatten the back out, neck stays straight, shoulders are off the table, and we're going to hold 5 to 10 seconds as he breathes. I say count out loud softly to yourself because that breathing is required. We want to stay flat and steady, no pain in the back. Raising your knee up helps to encourage what we call posterior pelvic tilt, or a flattening of your spine into the floor. And we're going to repeat this 10 times. You can do this 2 to 3 times a day. That's totally fine as long as you're not having any pain. If being in this position causes any kind of pain, then all you're going to do is lower the load. So instead of bringing your shoulders up, just relax those shoulders, bring your hands out in front, feel hip bones. Hip bones are going to come in, and then what you're going to do is flatten your back, fingertips on the hip bones, slide your fingers off the hip bones just into the side of your obliques where it gets soft, and then what you're going to do is just clear your throat or cough. You'll feel that pressure push back into your fingers, the side of your abs, push back into your fingers, go into a cough or a grunt, and then hold that right here, hold that in your belly, hold that, keep breathing. As you breathe, don't let this get soft. And then you're going to count out loud softly to yourself to 5 to 10 seconds. This is hugely important. This is what's activating the transverse abdominis. It's one of the 5 muscles that originate or insert onto this thick band of fascia in your low back called the thoracolumbar fascia. Fascia, which is a rigid connective tissue, much like a bed sheet where it'll fold, but it doesn't want to stretch. Because of its rigidity, it allows us to exploit that strength by bracing our low back through work of our abdominal wall. And so this is the first one that we're going to work on, called the transverse abdominis draw in, if the curl up is painful. If you have any difficulty at this level, give us a call. The next one is a side plank. On your side, on your elbow and on your knees, he's going to bring his hips forward so we're in line, shoulders, hips, and knees, and we're going to side plank up off the floor, keeping those hips forward, right in line with our hips, knees, and shoulders, and we're going to hold. These are all stabilizing efforts or stabilizing doses of exercise where we do prolonged holds. Work on 5, build to 10, go to 15, and if you can get to 30, great. 30 and beyond is fantastic. No pain, no wobbling, no shaking. That's what we want to be. You're going to hold this 3 times for 30 seconds. You can build up to that though. Don't feel like you have to be able to do that all at once. If you can do 5 to 10 seconds at a time, that's great. Just work to build up to be able to sustain or hold 30 seconds at a time, up to 3 times, and do both sides. The last one of the big 3 is you're just gonna need a towel, hand towel, roll it up. It's only about 2 inches thick. We're gonna put that under one of the knees. We're gonna do it to both sides, so it doesn't matter which one you start with. But now it's gonna tilt his pelvis and low back area. And what he's gonna do is he's gonna push his knee down into the towel, and he's gonna raise this one up. Now you notice we're just getting a little bit of this elevation, and that's all that we're working on. Start off nice and easy. Leave your foot down on the floor. Arms and shoulders are active, they're involved, but they're not overpowering. Also notice is he's not rotating his entire trunk, he's just rotating through his pelvis. If we can get to a point where you can raise that leg off, even better, it's more challenging. Allow yourself to be a beginner and work through the steps nice and smooth and steady without pain. We're going to do this 15 to 30 times with no pain. Do it twice a day. Classification 3 for specific exercise. This is when you have a directional preference, is what we call. So if you have relief with forward bending or relief with extending the back, once we identify which pattern or which movement preference you have, we give you some exercises for that. So if you have relief with forward bend, then we work on getting you into more forward bending positions. The way we'll do this is we'll lay you down like this. We'll let you start off with bringing one knee up, grab this knee and pull it to your chest. And we're gonna hold for 30 seconds. This is called single knee to chest. If this feels pretty good, no problems, and you wanna do both knees to chest, you can do that as well. Holding knee to chest, you can go into a child's pose, which is a yoga, where you're on your hands and knees and you're sitting back into your heels. All different forms to work into flexion, and doing so gently so as not to get any kind of increased pain. These are all a stretch or mobilizing hold, so we work into 10 to 30 seconds. Find a pattern that works comfortable for you. With knee to chest, I like doing 30-second holds 3 times. With child's pose, I like doing 10-second 10 times. So at the end of 10 seconds, I have him come back up into a tabletop position, inhale, exhale 2 to 3 times, and then he sits back down into his heels. The other aspect of this that I really like is I want big inhales through his belly. So as he breathes, he's pushing his belly into his thighs. And what you're going to notice as we do that, we get more flexion, we get more bending across his low back, which is hugely important. Belly breathing is a fundamental technique that we work on for all our low back pain patients. For folks who benefit from extension, my favorite move is what's called prone on elbows. And so what he's going to do is he's going to prop up onto his elbows. He's going to push up into a little bit more extension. So go ahead and push up into extension. And we're going to work into extension through here. Sometimes I suggest putting pillows underneath your hips if you're having any kind of pain. That helps to dampen the amount of extension or load that you're going to put into your spine. And the other thing I like to do, we dose this doing 10 seconds up and then 10 seconds down. As he's up and holding the 10 seconds, he's belly breathing. So he's inhale, exhale, and he's pushing his belly into the floor with each breath. Breathing and working breathing with movement is hugely important, particularly with low back pain, because the diaphragm is another one of the muscles that attaches to that thoracolumbar fascia, which is that thick, rigid band of fascia, which gives our back the ability to be braced through abdominal contraction, through abdominal support. This is for classification number 3, the specific exercise program. So what we identify is a movement preference or a directional preference for low back pain. If you have pain with flexion, so if he bends forward and that produces pain, he comes back up and he goes into extension and that relieves pain, okay, then we know he has an extension preference, and those are the things that we want to work into to help improve his low back pain. We want to do the movements that he has a preference for. So we'll do a series of extension type exercises. If he goes forward and he gets relief, so these are your stenosis patients, these are the patients with lumbar degenerative disc disease, DDD, these are all the fancy terms that you'll see on an MRI or X-ray report, all to demonstrate some age-related changes to your spine. You get relief with flexion, you get pain with extension, then we want to do a flexion-based program to help you stabilize and be more comfortable throughout your back by doing those exercises or those moves in that position, which we'll show you. The 4th classification is traction. So any kind of decompression or decompressive effort is going to be very beneficial. And one of my favorite techniques is to be in this position in prone. What he's going to do is slide your elbows forward just a little bit so they're right under your shoulders, just slightly under your shoulders, go a little bit more. We're going to start right here, and then what he's going to do is he's going to allow his shoulders to fall down towards his wrists. Now you see as he does that, we get to elongate through his lumbar spine and get a tractioning or lightening effect through his low back. So if you come back up, see how we get a little bit of compression? As he lets his shoulders fall down, we get this lengthening effect. The trick is relaxing your hips and thighs, letting the kind of the friction or traction through your legs and thighs hold your lower extremities back to allow this fulcruming effect of the elbows locking into the floor of the table, and then his shoulders to then roll over top. That gets this lengthening effect through his low back. And as you do that, you should feel a relief. It should feel like a lightening event at your low back. I still suggest putting a pillow under your hips if any of this extension is uncomfortable. As you're down and holding for 10 seconds, you're still belly breathing. So your big inhale through your belly, exhale through your belly. Everything is happening through the belly. You see how this is rising and falling? As it's rising, we're getting more tractioning event through that low back to give you relief. This is my favorite traction position in extension, and then we'll show you one in flexion. All right, so the other form of traction that I like, easy to do at home, you can do this off the edge of an ottoman, off the end of your countertop, is you find a spot where you can kind of lean over. If it's a countertop and the surface is hard or rigid, put a towel down or a pillow. You're gonna lay down so your belly button is on the table, or your belly button is on the countertop. Your legs are relaxed, and what you're gonna do is he's going to hold on or grasp, kind of relax his arms down towards his hands, his shoulders down towards the end of the table, and then he's going to relax his lower half. As he relaxes his lower half, we get a tractioning event happening from the bottom up. So all this is relaxing and easing in. You should feel a lightening effect through here, and it will help reduce your back pain through a tractioning event. Again, I like to do active movements through traction, so my other treatment for this, as you're in any position of traction, is we're going to begin to work nice, easy pelvic tilts. So he's going to work on bringing his hips up and then back down. So we're working just lumbar pelvic tilts, back and forth. And then we're also gonna work bringing hip bone to armpit. So we're gonna work side to side. And we're gonna do 10. We'll even go in a clockwise position when we go back, side, forward, side, and just working all the way around the clock, moving his lumbopelvic junction to improve mobility of the lumbopelvic junction, which is where the lumbar spine sits on the sacrum, to help decompress that L5, S1, L4, L5, that lower lumbar vertebrae, which are the most commonly herniated discs, most commonly irritated areas of the lumbar spine. You're going to do each position 10 times. So I like to say just go around the clock, do that 10 times around the clock. Every time you come to the front, just count that as 1. That way it keeps the counting very simple. This is about smooth, steady, consistent movements. Don't feel like you're losing control of any one position. And if you find one spot is painful than the other, then just ease into where it's not painful. Go all the way to that doorstep of discomfort and then come back out of it. Don't feel like you have to go crashing through pain. Just ease into it, come to the doorstep, and then come out of it and then move on to the next one. As you move, it should free up, it should get easier and become less painful. All right, we just went over the 4 classifications of low back pain treatment. These are individual classifications to help you identify which one is gonna work best for you based on the type of low back pain that you have. Again, 50% will fit neatly into one of these classifications. The other half won't. It'll be a combination of the two. Don't feel like you have to go on this journey all by yourself. If you have any questions, feel free to reach out to us. We'd love to assist you in any way that we can. Remember, low back pain is very common. A lot of folks have it. Over 80 million every year are going to suffer some low back pain. So don't feel alone. Don't feel like you're going to be plagued or doomed to suffer from low back pain for the rest of your life. That's not the case. I hope these 4 classifications help you identify what you can do on your own. If you run into any problems, we'd love to help you out.